Imagine a world filled with the joy and exuberance of young children. Imagine a world where schools are a safe and secure place, where children can be at their best, where they can discover and express themselves, a place where they can give wings to their dreams. Imagine schools where teachers, staffs and parents happily engage in making schools a beautiful, healthy place, where all can learn and schools, homes and communities can stay connected. Imagine a world where all children everywhere, having acquired the knowledge and skills, the attitudes, behaviors and experiences, become well-rounded, healthy, happy, educated, caring and active members of the society. This is the vision and dream of a health-promoting school. Wow, that's wonderful! I would very much like to be a part of this world. So what is a health-promoting school?
A health-promoting school, or HPS for short, is a whole school approach where the school provides the foundation and a setting for healthy living, learning and working. At its core, it fosters the physical, social, emotional and psychological conditions for health as well as for positive educational outcomes. Did you know that HPS approach was first articulated by WHO, UNESCO and UNICEF in 1995 and adopted in over 90 countries and territories? It has evolved over the years and become even more comprehensive and inclusive.
Interesting. What does this approach entail?
The HPS approach goes beyond the mere delivery of health education, health services, and integration of health in the school curriculum. It encompasses the whole school policy, governance, educational system, the school's physical and social environment, and conscious efforts to create an enabling milieu that promotes physical and mental health of everyone in the school. It also extends to parents and communities, ensuring social well-being of children and adolescents.
The WHO Regional Director for Southeast Asia endorses the HPS approach, which recognizes that health and education are fundamental and intrinsic to human development. It is a transformative and collaborative approach that brings together students, parents, families, local communities and governance systems to enhance lifelong learning and increase the health and well-being of students, staff and the community. Truly, the link between education and health has never been more apparent. This is especially true in today's times where we are seeing a disruption in the education and well-being of children.
Absolutely. In June 2021, UNESCO and the World Health Organization further stepped on this movement by launching the Global Standards for Health Promoting Schools, a resource package for schools to improve the health and well-being of 1.9 billion school-aged children and adolescents. The importance of the HPS approach has become even more evident in view of the closure of many schools around the world during the COVID-19 pandemic.
What are some of the benefits of health-promoting school?
There are huge benefits. Let me share a few voices from the ground.
The health-promoting schools approach improves health, well-being of students, staff and the wider community. The healthier teachers are also role model for the healthier lifestyle that children can adopt.
HPS establish foundational knowledge, attitude, and behavior to enhance health and well-being and make healthier choices when we grow up.
It improves working environment, quality of learning and teaching, and leads to better educational outcomes.
With comprehensive health promoting school policy, we can provide better coordinated services and create an enabling environment for children in modern schools.
A key benefit of health promoting schools is multi-sectoral collaborations that support education, health, and well-being. It benefits everyone involved.
This approach leads to more equitable health and educational outcomes, including increased gender equality.
Effective implementation of HPS can reduce the burden of non-communicable disease among the children and adolescents, thereby leading to healthier life.
That's awesome! The benefits clearly highlight how important the HPS approach is for each one of us and the society as a whole.
Absolutely. An effective school health program can be one of the most cost-effective investment a nation can make to simultaneously improve education and health.
Tell me more about the recently launched global standards. I understand that this will ensure that there is greater consistency and adherence to quality.
The global standards and indicators are the backbone of the health promoting schools. They also provide a vision and a roadmap to make every school a health promoting school.
This is excellent. Please elaborate on these global standards.
There are 8 global standards for health promoting school systems. Let's look at Standard 5, 6, 7 and 8 to understand how a health promoting school looks like. Standard 5 highlights that the school curriculum promotes physical, social, emotional and psychological aspects of student health and well-being. Standard 6 is about the school having a safe and supportive social emotional environment to promote the well-being, confidence and mutual respect of all its members and local communities. Standard 7 urges that the school has a healthy, safe, secure, accessible and inclusive physical environment. Standard 8 emphasizes that all students must have access to comprehensive school-based or school-linked health services that address their physical, emotional, psychosocial and educational healthcare needs.
Wow, that sounds like a dream school. How can this dream be realized?
To answer that, we must look at Standard 1 to 4. These are the systems and governance backbone of this approach. Standard 1 is vital. It is aimed at the whole of government commitment and investment in making every school a health promoting school. Standard 2 is about the school's commitment and investment in a whole school approach to being a health promoting school, which is effectively reflected in school policies and plans. The focus of Standard 3 is on the whole school model of school governance and leadership that empowers the stakeholders and supports a health promoting school. Finally, Standard 4 signifies that the entire school community actively engages and collaborates with the local stakeholders as partners for health promoting schools.
Wow, these standards are designed to create schools that nurture education and health. They also equip students with the knowledge and skills for their future well-being, employability, and life prospects.
True. Importantly, it is these standards and how well they are implemented in letter and spirit that differentiate a health-promoting school from others.
To bring this vision to reality, each of us need to play an active role in implementing the HPS approach, take concrete actions and commit ourselves to this goal. WHO calls upon member states in the WHO Southeast Asia region countries to affirm their commitment to make every school a health-promoting school.